Real proud to sponsor Dr. Landon today. I'm just going to talk really briefly, and then, like Colleen mentioned, we have our booth over there, so hope to see you guys over there. We're just going to talk a little bit about sort of our airway clearance in general, and then we'll get into our company and then our product really briefly. I have about 10 minutes here to talk to you guys. So who we are. So Respiratory Care Solutions, we talk about this hospital to home concept is, we're going to continue to develop products to bring to market that are available for your patients both in the home, acute care space, long-term care, and then obviously for home care as well. And so we do have respiratory therapy devices. Currently we have 2 devices. So we're kind of a small startup company here in the US, but we're a global company. And we have 2 devices now. We only have 1 device here in the US, and we have a ventilator internationally that isn't here in the US. But we do have 60 global employees, most of which are research and development folks actually overseas that are bringing these products and developing these products, and then we'll get them here to you guys in the US. But we pride ourselves on having highly technical devices, and they're all going to be in this respiratory space. So we've helped to date. The product that we have here in the US is called Byways Cough, and we've had this product available, FDA approved, for a little over 2 years. And we've helped up to 1,500 patients here in the US so far, and we continue to ramp up, and we're going to continue to help these patients with this device. So we'll talk about that device here in just a little bit, but our goal is essentially what most companies these days goals. We're going to develop products that help provide a better quality of life, improved clinical outcomes, and then ultimately overall reduced healthcare costs for your patients. So let's talk about why we developed our products, or where we're sort of headed with these products is, we want to help you guys help your patients break this cycle of repeated lung disease due to retained secretions. So, you can see here in this sort of vicious cycle, when patients develop an initial lung infection, it can lead to inflammation, more mucus, and then as they retain mucus, ultimately, if they can't clear the mucus, these patients develop permanent lung damage as a result. So on a regular basis, we want to help these patients mobilize these secretions and just keep the lungs clear of secretions. So how do the lungs clear mucus? There's sort of 2 main ways, and you guys as respiratory therapists all learned about this at some point, but you may not talk about it on a regular basis, so it's a good reminder. We talk about these 2 sort of main linked functions that help us as humans clear secretions. And we've got this mucociliary clearance or mucociliary escalator in our lungs. So you guys remember the little hair-like structures in the lungs that beat rhythmically to sort of help continuously move this layer of mucus up and out of the lungs on a regular basis. Well, you and I have no problem with this function. It works on a regular basis, and a lot of times we just swallow these secretions. So again, we call that mucociliary clearance, or MCC, and these hair-like structures beat rhythmically right around 15 to 20 hertz and is sort of constantly or continuously working. And if that gets overwhelmed, then we as humans just cough these secretions out. Well, sometimes your patients have trouble with either one of these or even both of these functions. So they either have a problem with their mucociliary escalator, or they just have a problem coughing. So we're going to talk about that in just a little bit. And this is sort of what that effective mucociliary clearance looks like. Again, sort of like wind through a wheat field or waves on an ocean, these are beating together rhythmically to help move this layer of mucus out of the lungs. And when that doesn't work effectively, that mucus layer just sort of sits there and obviously serves as a warm, wet environment to promote bacteria growth, and then these patients develop regular infection or pneumonia. So let's talk about cough a little bit. How do we measure cough effectiveness in patients? Well, some of these clinics are getting pretty smart at measuring this, and we wanted to put some value on this. And normal peak cough flow, well, first of all, let me back up a step. So the picture you see on the right is just a standard peak flow meter, and again, we've gotten pretty smart about this. We hook up some sort of patient interface, and we essentially have the patient cough into this peak flow meter, and we measure that. And normal peak cough flow for you and I, we can generate around 360 to about 720 liters per minute of peak cough flow. Your patients that you're dealing with sometimes can't generate that cough flow. And they sort of mentioned that anything below 270 liters per minute or less are patients we should consider looking at these different cough devices for. So mechanical insufflation, exsufflation is one of those, and it's recommended in patients where this value is less than 270 liters a minute. And then right around 160 is considered completely ineffective. So let's talk about some other airway clearance modalities. So we talk about high-frequency chest wall oscillation as well. You guys may be familiar with that. These are your vest devices that go around the chest, and they create airflow by gently squeezing and releasing the chest wall. So they do require the patient to put a vest on around their chest. And then they wear it for generally around 20 to 30 minutes, maybe a little bit longer. And that squeezes and releases the chest wall to move those secretions up and out of the lungs. And typically these are pulmonary patients, but that function, that high-frequency chest wall function, serves to replace that mucociliary escalator if those patients are having difficulty with that. And then we talk about MIE therapy, or mechanical insufflation exsufflation, cough therapy. This is meant to replace cough in patients who can't cough effectively. So this is really just really another way to deliver non-invasive suctioning in patients. So again, it's meant to replace cough in patients who can't generate that cough effectively that we talked about just a little bit ago. So who benefits from MIE therapy? Again, because it's replacing cough, or it's for patients with a weak cough, a lot of times we see this prescribed in patients that are neuromuscular in nature. So we treat a lot of spinal muscle atrophy, ALS, muscular dystrophy. Even in the pediatric population, we see it ordered for patients with rare genetic disorders and whatnot. But obviously spinal cord injuries in the adults are good candidates for this. And then even myasthenia gravis and post-polio patients as well. So it tends to be a lot of neuromuscular patients, but it can really be for anybody with weak or ineffective cough. So here's the byways, and again, please visit our booth, but three main categories. We talk about our product as being hygienic, intelligent, and intuitive. And then from a hygienic standpoint, the reason our device is called byways is because there's actually two completely separate pathways inside this device. So you can see two different pathways, two different blowers, and these two blowers actually work in concert with one another to just make this cough therapy more efficient at delivering this cough. It also makes the oscillations that are available in our device much more consistent and much more effective as well, and we have some good data on that. We also have a feature called PEP on pause. So during the pause phase of the cough cycle, so after it enters that insufflation, exsufflation cycle, it goes into pause. We can actually deliver a pressure, sort of like a PEEP, anywhere from 0 to all the way up to 15 centimeters of water pressure. And we do feel like keeping these pathways separate promotes hygiene in patients as well. And then we also have advanced therapy programming. We have the ability to control our device with a remote control or through an app on a phone. And then we're developing, and we'll see very soon, a feature called ARC Connect. Every Byways device is Bluetooth and Wi-Fi enabled, and it allows you to connect these devices and send data to that portal as well. Intuitive, we can store up to 10 therapy profiles. And then our device is much slimmer design. It's a low profile design, weighs about 9 pounds, and every device comes with a battery already included. So I know that was a feature that was an option in many cough devices. And then ours is really easy to use with a touchscreen interface. So this is a comparison of some of those features and some of the devices that you typically see on the market. We talked about all of these already, so it's really just a comparison between all three of the devices that you see on the market typically. And then rounding out the last minute, I'll just review this data that I talked about that was gathered. This was done by Seattle Children's Research Institute. So this was a white paper comparing our device to the Philips T70 device at virtually every setting. So they compared these two devices at 20 centimeters of water pressure, 30, and then 40 centimeters of water pressure. And you can see the graph on the left just shows that our device was better at delivering this cough therapy, so provided higher flow acceleration or higher peak cough flows at every setting. The graph you see in the middle actually compares our PEP on pause feature with it only at 5 centimeters of water pressure versus off, and it improved the volume of the lungs inside the airway by 450%. And then the last graph on the right just shows the oscillations compared with our device versus the T70. And I know that I'm rounding out time, and I see the clock, and Colleen's coming up to give me the yank. So I just want to thank you guys for allowing me to talk. Again, we're proud to sponsor Dr. Landon. Please visit our booth, and you'll see our device there. Thank you so much.